Hello everyone. So in this video we will be discussing about combined oral contraceptives, their mechanism of action, their advantages, disadvantages, their contraindication, and everything about oral combined contraceptive. So before that, let's see about what are the various types of steroidal contraceptives. So firstly, seeing the classification, we have oral steroidal contraceptive that include combined preparation, that is combined oral contraceptive, and the single preparation. In combined oral contraceptive, we have monophasic, biphasic, and triphasic type, and we have also the emergency, that is postcoital pill. In single preparation, we have progestin only pill, that is mini pill, and estrogen only pill, that is for emergency. In the parental formulation, we have injectables like DMPA and DMPA, depot medroxyprogesterone acetate, NETEN, NETEN, norethistérone ethanate, and combined. In implant, we have Implanon, Norplan 2, and LNG rod. On device type of contraceptive, steroidal contraceptive, we have in intrauterine device, we have levonorgestrel intrauterine system, that is called Mirena, and we have vaginal ring, that is LNG ring, combined estrogen and progesterone ring, and in transcervical we have Essure. And for the patch, we have the transdermal patch, that is Nestorone. So we will be talking about combined hormonal contraceptive. In this, we have combined oral contraceptive, combined vaginal ring, and combined transdermal patch. So mainly we will focus on this combined oral contraceptive, COC, in this video. The combined oral contraceptives pill is the most effective reversible method of contraception, and other form of combined hormonal contraceptive include this vaginal and transdermal patch. But the contraceptive efficacy and side effect of all these combined hormonal contraceptive are very similar. In the combination pill, the most commonly used progestin, or that is synthetic progesterone, is the levonorgestrel, norethistérone, and desorgestrel. These are the three synthetic progesterone that is used in combined preparation, combined oral pill: levonorgestrel, norethistérone, and desorgestrel. And estrogen, we have the ethinyl estradiol or mestranol, and mestranol is usually 3-methyl ether of ethinyl estradiol. So before this, let's discuss one more thing, that is about fourth generation progestin, that is known as drospirenone. It's called drospirenone. It is an analog of spironolactone, and it has anti-androgenic and anti-mineralocorticoid action. It causes retention of potassium, just like spironolactone, and also anti-androgenic action, just like spironolactone. And so that's why this drospirenone should not be used in patients with renal, adrenal, or hepatic dysfunction, and serum potassium should be monitored. So what is drospirenone? This is fourth generation. This is used as fourth generation progestin. Okay. In the combined oral contraceptive, we have various synthetic name, that is Malay and Maladi, mainly in India, Nilocon White, Sunologulaf mainly in Nepal. So all of these have the similar composition, that is they have levonorgestrel 0.15 mg and ethinyl estradiol 30 microgram. So this combination is very, very important, and it is better to remember it again. Levonorgestrel 0.15 milligram plus ethinyl estradiol 30 microgram. And additionally they may contain ferrous fumarate, 7 ferrous fumarate tablet, that is 75 milligram ferrous fumarate iron tablet for in the pack formulation, 21 hormonal pills and 7 this iron tablet. And we have next type of contraceptive, that is known as low-T or with, that contains desorgestrel plus ethinyl estradiol. And we have also the Yasmin contains drospirenone, as we already said, 4th generation progestin plus ethinyl estradiol, drospirenone 3 mg plus ethinyl estradiol. So now talking about mechanism of action of common oral contraceptive, we have firstly the mechanism of action is inhibition of ovulation. There is both hormone estrogen and progesterone synergistically act on hypothalamo-pituitary axis. Estrogen suppress gonadotropin releasing hormone that suppress follicular stimulating hormone and prevent the follicular growth, and progestin suppress luteinizing hormone and they prevent ovulation. The release of gonadotropin releasing hormone from the hypothalamus is prevented through negative feedback mechanism. Thus, there is no peak pulsatile release of follicular stimulating hormone and luteinizing hormone from anterior pituitary. So, follicular growth is either not initiated, or if initiated, recruitment doesn't occur. There is no ovulation, and that is the main mechanism of action. Inhibition of ovulation is the main mechanism how this combined oral contraceptive pill act through. Now another mechanism of action is they produce static endometrial hypoplasia. There is stromal edema, decidual reaction and regression of gland, making endometrium non-receptive to embryo. And another mechanism of action is there is alteration of character of cervical mucus. There is thick, viscid and scanty, so they prevent the sperm penetration. And also probably they interfere with the tubal motility and alter the tubal transfer. Thus, even though accidental breakthrough ovulation occur, other mechanisms prevent the conception. The estrogen inhibit follicular stimulating hormone rise and prevent follicular growth. It is also useful for better cycle control and to prevent breakthrough bleeding. Mainly now we will talk about selection of patient whom to give COC. First of all, we should thoroughly take history and general examination. We have to especially screen for any contraindication like headache, migraine, and if examination, we have to do examination of breast for any nodule, weight gain, blood pressure are to be noted. The pelvic examination are to be done to exclude if there is any cervical pathology, and it is mandatory. And pregnancy must be excluded before we have to give COC. Cervical cytology like SPB screening to exclude abnormal cell is preferably done. Thus, any woman of reproductive age group without any systemic disease and contraindication is suitable candidate for combined pill therapy. So, any woman of reproductive age group without any systemic disease and without any contraindication are suitable candidate for combined pill therapy. The growth and development of pubertal and sexually active girls are not affected by use of pill. So we will see the how in which patient there is no restriction if they have that belongs to WHO category 1. In WHO category 1 there is no restriction of use of combined oral contraceptive. And what are those population?